The views and opinions expressed on this program do not necessarily reflect those of the advertisers, owners, or management of Pacific Telestations, LLC. For comments, opinions, and questions, please email Jess Lujan at jessthebuzz@gmail.com. The Buzz with Jess Lujan.
Good evening, Guam. I'm Jess Lujan. Yes, we're on location. We're at Senator Rodriguez Mobile Care Clinic, and we're here in Dededo. I know last week you had your first community outreach.
Yes.
But anyway, welcome.
Thank you so much.
Thank you again.
Thank you very much.
So yeah, last week you had your first outreach to the community. Tell us all about that. I know we ran a story on the mobile clinic, but
That's right.
Again.
Well, it's very exciting. We have this mobile clinic that we started last week. We had an outreach over in Agana, Paradise Fitness Center in Agana. We had an overwhelming support from volunteers. We had nurses and doctors come out, and it really showed what this mobile clinic could be moving forward. People are asking for what's the schedule of this mobile clinic moving forward. And after that first outreach last week, we were able now to determine and put a schedule together that will take us all the way to the end of the year. And then after that, of course, moving forward, because the bottom line, the goal of this mobile clinic is to decentralize on how healthcare is provided in our community. But most importantly, it is to be able to outreach to those people without health insurance.
Health insurance. Okay, and also prevention, right? I
Yes,
mean, early
absolutely.
detection of,
That's right.
yeah. Now, in regards to what services will be offered or what testings will be offered, I understand. I mean, we're here in the examining table as well, but I know there's another room here as well that you said you're also going to be working with some volunteer dentists
That's right.
down the line here
That's right.
to do some dental outreach as well. Yeah,
That's right.
Yeah.
So we're right now in the process of outfitting this mobile clinic to have a plumbing system.
Okay.
So that we can bring our dentists, our local dentists, with us.
Okay.
And it really showed last week when we had our outreach. Nurses, the post, the debriefing after the outreach was that we really need that component as part of this when we go out. They saw a lot of children that did their physical exams and immunizations, and they said we really need a dentist on board with us because they saw the need to examine the kids.
Now, I mean, I'm very familiar with mobile clinics. I know it's done a lot in the Philippines. I know my
That's
wife's
right.
involved with a lot of the outreach, medical outreach, dental outreach, a lot of things. And yeah, they take them out to rural areas,
That's right.
to people who don't really have, accessibility to healthcare, dental care, and all this. What does it say then about our community? I mean, of course, the generosity of our community to help to contribute to on making this, but you also chair the GMH and the situation there financially, okay?
That's right.
And a lot of it, of course, is due to the self-payers,
That's right.
or basically
That's right.
non-paying
That's right.
patients. So educate us on that.
Yeah. Well, and that's what really motivated me to pursue this. A friend of mine who built this, who got this, who had the vision first, wanted to do just that, go out to the villages, and so we shared that same vision, and what inspired me really is looking at the huge population of our self-paid people who don't have insurance or who don't have the ability to pay for health care. So what happens is that when they get a cold or a flu, when they have an illness, they sacrifice and they try to bear as long as they could that illness. And then when it gets very bad, when it gets a serious stage, then they end up at GMH. And we all know at that point, treatment is more complicated,
Sure.
and it costs more as well. So if we just, I say it's one individual at a time, be able to reach out and touch them, give them access to primary and preventative care, then we can really address that situation at GMH. That doesn't mean that we can't, we need to not look at other alternatives now that we're all pursuing. But it really is now taking talk to action, because we've seen the numbers, we've seen the statistics, Now it's just bring it out there to the people.
And you know, you bring to mind the necessity, and the reason why I'm saying this, what is this saying about our community, right? Of course, the generosity of the medical community, yourself, and friends of yours that help to fund and put this together. And I know we have a great outreach program as well for doctors and nurses as well. You're very involved on outreach to the Philippines whenever there's disasters and things of that nature. But also it's time to look from within. That we also need that, okay? As we reach out, we also have to be reaching out to ourselves here, our home, because it's much needed here. Now, I know in other outreaches in other countries, I know the outreaches as the doctors and nurses have gone, and you yourself have gone too. You guys bring along like medications as well and all that. Now, the clinic, I don't know at this point, your mobile clinic, whether they're given out, you know, through the doctors that are volunteer and the nurses, whether they're able to do that now. Is that something you're striving for down the line to get, again, maybe some clinics and maybe some drug companies to help, you know, again, offset some of them, because they come here and they say, oh yeah, you need antibiotics, but if they're self-pay and they don't have the ability to pay, no insurance whatsoever, so we've detected that there's something wrong, but we're unable to give them the meds. Yeah.
Yes. Thank you for bringing that up, because that's the mission of this mobile clinic, is to give them that whole, you know, the whole service, because it doesn't make sense. You're right. When they come here, they tell you what's wrong with you. A lot of times, patients know what's wrong with them.
Yeah.
And so it's the follow up as well, and giving them the medication, and also we're looking at the component of bringing labs, our local labs, with us. You know, when we do go out. But you know, a lot of times, some of these results take time, right? So. Our partners, our local partners here, are very much willing to do that, and so this mobile clinic will definitely be able to do that, and that's the vision.
I mean, this, you know, Senator, this is not a small undertaking. This is a big undertaking. You know, I can see this growing. I can see you needing 2 or 3 more mobile clinics, and actually, you know, it's kind of like Guam. The temporary will become permanent.
That's right. That's right.
At some point, but. What I'm getting to as well is there's a great need. There's a great need, and we also talked. I mean, people like on the south, you know, they have their public health is down there as well. But in these areas, as much as we say, hey, Guam is very small, but we're really spread out. And okay, we have now 2 hospitals. Okay, and the clinics, there are not too many clinics down in the south. I mean, some of them are kind of migrating that way, but they're still really not down. So it's an underserved community. So that being said as well, you know, starting the school year, kids that are going to be participating in sports and things like that, and maybe parents don't have money for their physicals, the kids' physical as well. Would that be something that holistically be provided by the clinic down the line here?
Yeah, actually last week when we did the outreach, we did, I think, over 60 physicals. And so we had doctors here. They provided the physicals, and you know, there was this one lady, a mom, who approached me and really was, I was so touched by it, because she said that they were scrambling, thinking how she has 3 kids. How can they pay for the physicals? Because I believe it's about 65 to 85, and you know, depends on where you go.
That's a lot of money.
It's a lot of money, especially if you have 2 or 3 kids, right? And so she said when she heard about this, she was really, you know, she said she was been praying about it, and so God answered her, because she finally was able to take her 3 kids to get the physical. So as long as, it really depends on our doctors. As long as they're willing to do it, as long as we have them, we'll make this available. Because really, it's you know, what I do is very small. It's just, you know, have this facility, but it's them. It's them. It's the partners, the pharmaceutical, our local pharmaceuticals here. The lab companies that would now provide their service, and they're all willing to do it. They've done it for outreach in the Philippines or the other islands, so now they're happy that they're able to do it here for our community.
Now, let me ask this as well, because you know we're talking about, but I tell you, before we get into it, okay, we have to take a quick break. We've got to pay some bills.
All right.
We got to do that.
That's right.
Okay, and then we'll continue to talk more about this mobile health clinic, Senator Rodriguez mobile health clinic. Be right back.